Hi, everyone, and welcome to the Colorado State University Prevention Extension Cast. I'm Dr. Nate Ricks, and I'm the executive director of the CSU Prevention Research Center. I use he, him pronouns, and I am coming to you from my office in Alder Hall on CSU's main campus. I am joined here today by Dr. Christine Fruhauf, my friend and colleague, and we're going to be talking about connections between healthy aging and prevention science. So a little bit about Dr. Fruhauf is that she earned her bachelor's degree in Bachelor of Science in Human Ecology at The Ohio State University. You have to say the and pronounce it as the when you're saying The Ohio State University. And then she received her master's degree in Family and Consumer Science and a graduate certificate in Gerontology at the University of Akron, and then finally her PhD in Human Development at Virginia Tech. So currently, Christine wears a lot of hats here at CSU. She's a professor of Human Development and Family Studies. She's also the director of HDFS Extension, which we'll talk about a little bit later today. She's the program coordinator of the Gerontology Interdisciplinary minor, and the director, this is my personal favorite, the director of the Healthy Aging Division at the Prevention Research Center here at CSU. So we'll get started here in a minute, but for those of you who have yet to join us for a Prevention Extension Cast, I'll be moderating a 45-minute Q&A with Dr. Fruhauf about intersections between adult development and aging and prevention science. And then after that, we'll have some time for Christine to respond to some Q&A from the audience. So what I'd really like you to do is, as questions emerge throughout the first 45 minutes of our conversation today, drop those questions in the Teams Q&A, and I'll relay those questions to Dr. Fruhauf. So, and as always, really like to thank the USDA and the National Institute of Food and Agriculture for supporting the CSU Prevention Extension Cast. So let's get started. My first question to you, Christine, is how are you doing today?
I'm great. I'm so happy to be here. It's a beautiful day in Colorado, and I'm just excited to share a bit about prevention science and healthy aging. As you know, Nate, you are a dear friend and colleague, and you've been doing such great work at the Prevention Research Center, and it's just happy to be part of it.
Sounds great. Yes, it is a beautiful day. It's finally not raining.
I know.
Which is nice. All right, so the next question I have for you, the first real question I have for you is, a lot of folks might not see an intuitive link between aging research, healthy aging, and prevention science. So how can prevention apply to healthy aging?
Yeah, thanks for that question. I'm starting to think about this more in my role as the division director of healthy aging for the Prevention Research Center. And I've kind of come just more recently to this conclusion is that there could be like 3 stages to thinking about prevention science and healthy aging. And the first one being thinking about typical age-related changes. So we know as our body develops over time is that there's changes to our senses. Those are some of the first things that we see change. So in our 20s, as young as our 20s, we start to see changes in our hearing. So if we think about being a child or a young adult who wears headphones, we might want to make sure we don't turn the volume too loud on those headphones as a hope that we can prevent any kind of hearing loss, hearing damage later in life. So simple things like that could be thinking about, prevention science and healthy aging. But the second thing that I think probably most scholars in gerontology and adult development and aging, and even in prevention science, probably really think about healthy aging from the context of preventing chronic illness and disease. So we used to talk about the 3 leading causes of death, but more recently, because of COVID-19, we're really talking about the 4 leading causes of death, and that's heart disease, cancer, stroke, and COVID-19. And so one of the things that we can think about across our lifespan is prevention of these illnesses by screenings, right? So screenings for chronic illnesses such as cancer, colon cancer. right? Screening, seeing your doctor every year to get your blood pressure checked so that we can reduce heart disease. Screenings as quick as a A1C quick test in the doctor's office for type 2 diabetes, checking your A1C. So that could be one thing that we think about for prevention science. But we also talk about immunizations for diseases such as flu and pneumonia, which quite honestly negatively impact older adults at greater rates than younger adults, right? We have greater challenges when an older adult who might have some compromises when they get the flu or they get pneumonia. So thinking about immunizations for those two, but also COVID-19, because we did see higher rates of COVID-19 deaths among our older adult population. But then we also can think about preventing falls. Right? We know that 95% of hip fractures in the United States are caused by a fall, right? And if you have 2 falls or more a year, you have greater risk of challenges with a number of other things like completing instrumental activities of daily living, right? Which then could lead to even greater risks of then having problems with activities of daily living. We might also want to just think about preventing challenges with driving. Thinking about preventing elder abuse and financial fraud. So often our older adult population is targeted, particularly around financial fraud. So what can we do to make sure that our computers are safe, that we recognize the signs of somebody trying to scam us? And so those are real challenges. And then the last kind of stage that I think about prevention science when I think about healthy aging is if we were to be diagnosed with a chronic illness, let's say cancer, we can still prevent reoccurrence of cancer after treatment through various interventions, such as just increasing and maintaining physical activity, eating correctly. So even with a chronic illness, we can prevent any long-term negative impacts. And then I want to also just, say that preventing caregiver burden and burnout. So if you think about family members who often provide care and support to those older adults who might be more frail, they oftentimes experience stress and strain. And so can we intervene in making sure that those caregivers don't have any long-term negative impacts?
Yeah, that's great. I really enjoy listening to you talk about prevention in this way, and it really makes me think, I've been in this field for 20 years, and it makes me think about prevention in different ways that we can promote public health and prevent behavioral and mental health challenges in older individuals, because prevention science has had such a focus, I'll say, on early in the lifespan. And to really hear you talk about how we can start prevention later in life. And I think your work is really innovative and it's timely. I know that the field of prevention science is really starting to think about, okay, we need to really think about this as a lifespan profession.
Yeah, no, I love that you said that. So I would say in the last 10 years, the literature has, and I was trained as a lifespan gerontologist, right? Really considering what happens earlier in life that may have an impact, whether that be positive, negative, neutral, later in life. But we still talk about lifespan development, but in the context of probably prevention science, I think we're starting to talk about health span, right? Is thinking about maintaining healthy living for a majority part of our life so that we can compress the time to which maybe disease sets in and then ultimately death. And so a concept that we often talk about is compression of morbidity. We've done really good over time in compressing that time where we're at our sickest, right? Where we're challenged the most. And so if we can continue to think about prevention and healthy aging from a health span standpoint and thinking about that over time, I think that we can continue to unpack this more. So I just also love the fact that we're talking about prevention science in healthy aging, because when I go to my annual conferences, one in particular, Gerontological Society of America, we don't often talk about it this way. And last year in particular was like the first time we had our face-to-face since COVID. And now the question I asked most of my colleagues was, tell me about what you think about prevention science and healthy aging. And they always say, well, preventing what? And I go, exactly. So because of my conversations with you, Nate, I'm starting to push my colleagues to think about that in other ways. And so it's fascinating to even just talk about that with other scholars in this area.
Great. So, one of the great things about being a part of a land grant university is that we have this built-in network of extension professionals that historically have been a really great diffusion channel for science and technology, engineering, agriculture into our communities and especially rural communities. And I think recently, we've seen a shift, although this work isn't totally novel for extension professionals, but we've seen the shift in a focus on society's mental health and behavioral challenges, and extension being interested in being a diffusion channel for research into communities around mental health. Now, you are also the director of HDFS Extension. Can you tell us a little bit about this role that you fill for the university and how CSU Extension can, facilitate some of this community-based work?
Yeah, so, gosh, yeah, it's been, I think, 11 or 12 years now that I've been in this role. I would say for the majority part of the time I've been wearing this hat, I really have thought about myself as a matchmaker. So when I think about that, I think about the great work that's happening on our main campus among our research faculty, and the great work that's happening in the field among our extension faculty. And because I connect with my colleagues on campus on a daily basis, and then probably monthly, weekly, depending on what groups I'm in with my extension colleagues, I listen and learn quite a bit about what the needs are in the community and what my colleagues are studying. And I try to match faculty to extension agents in the field that are doing programming that is related to the research. And so I think that's the first and foremost, is just making sure that we can have connections back to campus and into the community. Because I do think having this community university partnership, which is really also what I think about extension, elevates the science that we're also producing on campus from this kind of community-based participatory research. So I think that's one thing. But what I have to say, and if I could add, I would say the last couple years at CSU, we've really had a strong focus on rural health and wellness. And I've been really excited about the fact that we have 4 new regional health specialists that are focused on rural parts of the state, all within ideas of mental behavioral health, healthy aging, public health, healthy living, food science, human nutrition. And although one of them is healthy aging, I think all of them touch on aging related aspects, right? Lifespan, healthy living, increasing health span. So I think there's the prevention science piece there. So I think it's a really exciting time here at CSU, because you're right, Nate. CSU is not unique to thinking about health and wellness or even healthy aging from this extension standpoint or from the land grant mission. But perhaps we're just a little bit later than some of our other colleagues at other land grant institutions, and that's okay. We are learning from each other, right? We're learning from the best. But I can tell you then, some of the specific projects I've been involved in and have really enjoyed in this, particularly this last year, is there's 3 examples. One example is I've been working pretty closely with Logan County, which is on our eastern part of Colorado, rural parts, and I assisted them with their AARP age-friendly survey, which they administered last year, and we helped analyze the data. And what I would really advocate is, no matter where you're at, if you're an extension agent or a professional in the field, connect with your local AARP chapter or the state chapter, because there's dollars that they will help support you in conducting a survey to look at age-friendly communities and then also uplift that from a strategic plan standpoint. So we helped Logan County crunch some numbers. They're using that now to create their plan. More recently, we just started at the beginning of May, a grant that we received through the University of Colorado Anschutz campus to then work closely with Logan County's Coalition on Aging to help create an advisory board and then a strategic plan focused on healthy aging. And as you might expect, because I am a matchmaker, the focus is going to be on connecting faculty here on this campus to Logan County and to the Northeast Regional Engagement Center there to help them fulfill their strategic plan. So those are two examples. And then the third is I'm really excited to be working with one of the the regional specialists in the mountain region this summer, along with a graduate student from CSU Department of Psychology, where they're going to be interviewing individuals in 2 counties to look at mental health among older adults and adolescents. And then as a result, the hope is that we will have a strong recommendation to either create or implement an evidence-based program that focuses on intergenerational mental health. So just really excited. I don't know where that project will lead, but that's just one way or another example. And I know that there's other colleagues on this campus that are also partnering with extension agents on these summer internship programs. So those are just a few, but gosh, you know, I'm just one person, and that's why I matchmake. I have colleagues such as yourself and other colleagues in the Department of Human Development, Family Studies, and elsewhere on campus that are doing great work with our extension professionals.
Well, you know, that actually, your point about intergenerational health,
yes,
is a nice transition into the next question that I have for you, which is a lot of the great work that you do is around grandparents who are raising grandchildren. Can you first off, I guess maybe just describe this family structure and why it's becoming more increasingly common?
Yeah, so the grandparents raising grandchildren, or grandfamilies, right, is another term that we often use. So this is a family forum that I've been interested in since the 90s, since I was an undergraduate research assistant at The Ohio State University. And so really it's when grandparents and other kin, but I'm particularly interested in grandparents, but when grandparents take on the sole or the primary custody or guardianship or just parenting of a grandchild. And usually the population that I'm most interested in is when parents are not present in the home. So there could be various reasons, and perhaps that might be your next question, but I can even talk about the reasons. There could be various reasons why that parent is not present in the home. And that might be abandonment, neglect. It could be death of a parent, could be a pretty bad divorce. It could also be that abandonment, that neglect maybe was due to substance use and abuse of the middle generation that led to them not parenting and providing that oversight to the child. It could be mental health. We're seeing more instances of just mental health challenges. And there's a number. What I could also add is that when I talk to grandfamilies, because I'm pretty involved in some of our community county coalitions around grandfamilies in our state unit on aging and our state non-certified kinship unit. There's often many reasons, and grandparents remind me, you may not know all the reasons why, right? And so I can speak from the research that says these are the pretty common reasons, but there's usually a lot of reasons. And then lastly, I'll add, there's also been some changes within our Department of Children and Family Services. In the last 10, maybe 12 or 15 years, there has been a greater focus on trying to place children who are within the system with family. So with kin, with grandparents. So we have continued to see an increase, not just because of those reasons why I stated, but also because our departments of children and family services are recognizing, because of the great research that's happening, is that children do better when they're with family or where they're with kin. And so we see more placements now with kin. Not to say that foster, non-relative foster parenting is not also important, but those are perhaps some of the reasons why we've seen these increases.
Okay, yeah, and you mentioned that the research is important in this, and we always want our preventive interventions to be guided by theory and informed by the empirical research. And one theory that is commonly applied to families in general is the family resilience theory. And so, can you tell us what that is and how it can be applied to grandfamilies?
Yeah, so first and foremost, I have to give, just recognize Dr. Fruhauf Walsh, who really is the leader in writing about family resilience theory. So much of what I'm going to say is really from her work. But what I can tell you is, first and foremost, it does build on systems theory, and family systems theory is often grounded in our marriage and family therapy, so kind of a clinical kind of focus. But family resilience theory does include the investigation and promotion of protective factors, right? Or when individuals and families are under stress, where are their strengths? Okay, and so it's also thought of as the family's capacity to withstand or rebound from adversity, such as a grandchild perhaps all of a sudden needing placement with a grandparent, right? Because there's a lot of other contextual factors that maybe went on that led to that child now being raised by a grandparent. So how do we think about this in the context of grandfamilies, and how might grandfamilies, how is this family really relevant? So I think it's relevant because oftentimes, as I've said earlier, that grandchildren are usually in the care of their grandparents because of these adverse situations, and oftentimes situations brought on by the biological parents, right? We also see that grandparents and grandchildren often experience challenges. So, for example, grandchildren might struggle with peer relationships, building up friendships. There might be school performance challenges. There could even be financial challenges of the grandparent. Oftentimes I hear from grandparents, and we read in the literature, that grandparents either have to stop working to parent or they have to go back, right, after retirement. And so there could be challenges. We also know among grandparents is that when we compare them to their age-related peers who are not raising grandchildren, they have higher rates of chronic illness and disease, and they have higher rates of depression. And so just those risk factors alone could create some challenges that might need to be addressed and or overcome. And so because of that, we want to think about, from a family resilience standpoint, what are their strengths? Where are they resourceful? Where do they succeed? What do they have internally at their disposal, and what is external in their community or in our extension offices to which we can support them? What evidence-based programs are available that we know could help them make some changes if they are at risk? And so that's how I think we think about the family resiliency theory and how it can be applied to grandfamilies.
I like that. I think a lot of times we think about things from a deficit-based model, and I think probably especially when it comes to aging, right? But we have to recognize that grandparents, they bring unique strengths into this family system, and I'm just wondering if you could describe some of those unique strengths that grandparents may bring to this work. So the literature. So one thing I can first say, the literature. I have a dear colleague at Case Western Reserve,
She's now dean of the College of Nursing, but for the last 30 years, she really studied resourcefulness among grandfamilies, and particularly among Black grandmothers in the Northeast Ohio, Cleveland area. But she speaks about resourcefulness, and she talks about how mothers, in particular this case, but grandparents are able to look at, what skills do they have, what supports do they have, and then make ends meet, so to speak, when there are challenges. So I find that not only her literature, right, is robust in that way, but I think when I talk to grandparents in the community, what I see is they're just determined. They're determined to succeed. There's this internal drive to make sure that their grandchild or grandchildren are successful, that they graduate high school, that they, go on to college, if that is desired, that they can be a contributing citizen. And, so often grandparents talk about, I worry that they're not going to know what it's like to have a real family. And I'm like, but you are a real family, right? Your family might just be a little different and unique in many ways, right? And so sometimes I think grandparents can reframe situations so that they can think of things more positively. So, I don't know, Nate, it's kind of a hard question because it can vary. It varies so much. I find sometimes grandparents are humorous, right? They're loving, they're caring, they're dedicated. So, and they're not, I would say most of them, right? I'm speaking generally, most of them aren't afraid. They're hardy. They're not afraid to speak up. I find, and I'm gonna share this. I worked closely in the community with a local agency that really was focused on helping children who have an intellectual and developmental disability. Mm-hmm. And oftentimes our grandchildren do. So there could be a number of reasons why. And so oftentimes there's an added layer. It could have been something genetic. It could have been something that happened in utero during, using substances. So I found this, there was a colleague of mine who was helping grandfamilies advocate for their grandchildren within the school system. And one of the things he said, which now I continue to promote, he said, create a one-page sheet about your grandchild. What are their dislikes? Where do they thrive? What tactics seem to, do they respond well to when it comes to learning or when it comes to behavior modification? And take that with you to every school meeting when you meet a new teacher or you meet a new principal, so that they know about your grandchild or they know about your situation. And a lot of our grandparents do this, right? They have to tell their story over and over, but they do so in a way that I think is to advocate for grandfamilies, to advocate for their needs, to advocate for their grandchild. So that maybe was a long-winded answer to describing how I see grandparents and grandfamilies as resilient and having those strengths. So.
Well, there was a lot in there. That was great, and a lot of useful information. So grandfamilies, they can be resilient, but we can't pretend like this isn't oftentimes a stressful situation. I'm going to fold my next question into, there's a question in the chat that is really relevant to this question. So what are some unique factors that can create stress for aging families? And then what factors can mitigate that stress? And the question in the chat or in the Q&A is, do you have any resources or information on how grandparents can reduce or prevent stress dealing with all those family issues?
Yeah, so maybe let me start with the last one, and then I can pick up go to the first one, the big picture and stress. So I'll share with you a little bit about a 5-year project that was funded through USDA and NIFA and their Children, Youth, and Families at Risk mechanism. And that was a project called the Grand Cares Project. And I'm actually going to, while I do this, copy and paste in, I think it goes to the Q&A section, a website or a link to our website. So this was a 5-year project that had 3 main objectives, and it was focused obviously on supporting and increasing health and wellness among grandfamilies. The first objective was to adapt and implement a grandparent program. So the program we adapted was called Powerful Tools for Caregivers. And Powerful Tools for Caregivers is now operated out of the University of Iowa. And it's an evidence-based program for family caregivers or caregivers of adults who have chronic illness. So that was the original form, and it is evidence-based. And for those of you who are looking at, how to support family caregivers, I highly recommend you take a look at Powerful Tools for Caregivers, the original version. We worked with the developers and the organizers of that program to adapt a version that they had already adapted and tested, and that was Powerful Tools for Caregivers, the parents of individuals with intellectual and developmental disabilities. And so we adapted that just for grandparents, which was a very slight adaptation, taking the word parent, putting grandparent, just a couple little tweaks. But what we found in our 5-year project is that not only from baseline to 6-week post-assessment, we saw significant improvements in depressive symptoms and increase in knowledge and use of community services that support grandfamilies. We not only saw that at 6 weeks, but then we also did a 6-month follow-up, and those significant changes were sustained. So really exciting that this program in and of itself, we could see a decrease in these depressive symptoms, which we so often, as I shared earlier, know among our grandparent population who raises grandchildren that they experience. The second part of that program was a grandchild program. We worked in this project. We actually, it was a joint project with University of Hawaii at Manoa and their extension system. We created and implemented and tested a Grand Cares youth program, 6 weeks, similar to what grandparents were learning, but obviously developmentally appropriate for ages 9 to 12-year-old grandchildren. We saw trends in the right direction for changes in leadership, and we also looked at resiliency. We did not see any significant changes, I think, because our overall sample size was relatively small, but with hopes, those of you that might be listening today, if you are interested in wanting to implement that program, you certainly can reach out to me, and I'll put my email in here in a second so you can do that. And then the third part is we created a number, I think we created 12 very short videos for service providers who might work with grandfamilies but have had no training. We have discovered from not only my own personal research but colleagues is that oftentimes service providers, care caseworkers, social workers work with grandfamilies, but they have no training. And so we put these short little training videos together with hopes that we could help support service providers in that role. So that's just one large project with 3 different objectives that somebody might look at for a potential resource and implement in their community. But kind of going back to this kind of piece on like family caregiving resources, I would say reach out to each county should have, they often have, a local area agency on aging. So, and that area agency on aging gets federal dollars through the Older Americans Act that comes to your state unit on aging that can then trickle down to the county office to provide programs, to provide information and referral, to help support, perhaps even through respite grants. So in our county, Larimer County, I think last I heard, we have 12, every 6 months, we have 12 slots for grandparents who are raising grandchildren to receive a respite grant. And I think the dollars waver a little bit. It's anywhere from like $250 to maybe $400. And those dollars can offset hiring a child care provider. So maybe a grandparent can go out and have coffee. They actually also support, you can use that to support for a summer camp. To offset some costs to have that child go to summer camp, or offset costs of maybe sports. And so there's also similar, through the National Family Caregiver Support Act, similar dollars that are dedicated just for family caregivers who might be caring for an older adult. So I first and foremost say, go to your area agency on aging, reach out to them, see what they have available. And then I would also just look to like senior center for more social related activities or enrichment activities that could help, you know, decrease perhaps any social isolation if there's, you know, some challenges there. So I think I've answered your question, Nate, but help me if I need to fill any holes.
No, that was a great one. So there's another question that popped up in the chat that is relevant to this as well. And so you may have gotten maybe 90% of this question already, but maybe there's another 10% that you might be able to add. So this question is around, you mentioned prevention efforts can help concerning health outcomes for aging populations like cancer, diabetes, falls. How does mental health and behavioral health affect the aging population? So maybe that's more of a basic science kind of question, but then is there a role for prevention?
Yes, yeah, so thank you for asking that. So some of the most recent statistics that I just saw is that 46% of adults, our population age 65 and over, say that they are socially isolated. 46%, that's a lot. I found that statistic pretty high. And so, okay, so maybe there was an increase after COVID okay, so we could just kind of put that to the side, but I'll say that the literature in social isolation and loneliness in the last 10 years have increased. There's been an increased awareness because social isolation, right, and then loneliness, so they're different, right? I could be socially isolated. Maybe I don't connect with individuals on a regular basis, but I'm not lonely. Maybe I like that. Maybe I'm okay with that, right? But when you have social isolation and loneliness, having, you know, not having those connections, and as a result that could lead to other things, those are problems. And we see increased mortality rates among individuals that have both identified social isolation and loneliness. And some scientists have said, now I have colleagues over across campus in health and exercise science are gonna, you know, hate me when I say this, but there's some scientists that say, well, you know, social isolation is just as bad as smoking so many cigarettes a day or not exercising, right? But I think the point and the question I appreciate, right? Mental health is important, and we need to talk about mental health just as we talk about, you know, chronic illness, preventing chronic illness. So, okay, so then to get to your question about how do we maybe prevent social isolation, or maybe how do we intervene? So what I can tell you is one of our dear colleagues, extension professionals in the field in that northeast part of Colorado that I already referenced. About 2-3 years ago, they were starting to see social isolation really kind of creeping up among their rural older adult population. And so they created monthly, they call it coffee, tea, and we. And so the we is they just get everybody together once a month. And they not only do this face-to-face, but they can remote people in because there are some people that it's just too hard for them to get to the center of town. And they chat. They usually, I think they first started just by chatting. What do you want to talk about? And since then, it's grown. They've invited researchers to come talk. They've had like a cooking demonstration class. They wanted to learn how to make pasta sauce, you know. So just as simple, you know, from an extension standpoint, it's just bringing people together to talk. I think now, to be fair. We haven't evaluated that club to see, do we see changes? But what I hear, the anecdote, the comments, what I hear is that it's a success. It's grown. They've even, because they are recognizing that they have a Spanish speaking population, or a population that would prefer to meet and use Spanish as opposed to English. They've kind of had this offset group that's created now. So they've got multiple groups that are just coming together. So it's just really exciting to see stuff like that. There's also, it's called Aging Mastery Program, which I know is being implemented all across Colorado now, which is a 10-week program promoted by the National Council on Aging, evidence-based, to talk about just a number of different issues around aging, preparing for aging, finances, to just healthy living, to volunteering, getting involved, because we know that there's benefits to our mental health from that. So I think I answered your question there,
Yeah.
but again, let me know if you need me to share a little bit more. No,
that sounds great. Yeah, so staying on the prevention topic, sometimes we think in prevention, if we build it, they will come, and sometimes they don't. So when it comes to the interventions or the prevention programs that you've been talking about, how accessible are these programs, are these interventions for older individuals? And do you see the need to adapt or otherwise change the dissemination strategy?
Yeah, such a good question. And yeah, I mean, right, evidence-based programs often, and the ones that I've mentioned today, excuse me, have a sip of water. There's usually a training portion. So one, there's go through a day or two of training so that you can become familiar with the curriculum, familiar with the program, and know what the appropriate ways to implement it as it's been tested and shown to be evidence, right? And so quite honestly, those cost money, and sometimes agencies or even our extension systems may not have those additional dollars to help support that. So obviously then, right, that's where needs assessments come in, and prioritizing, what does your community need? What's the state need? What's the community need? What are you seeing in those needs assessments, and then being able to focus. And so then once you've kind of identified that, and hopefully sought out resources that can help you go through those trainings. And I would also add, again, from that university community partnership, think about your other colleagues, in your counties. Think about that office on aging, or that area agency on aging, or that senior center, or that other, nonprofit, even local hospital systems or clinics, because you could pull dollars together to perhaps, go through trainings to help implement that. But then when it comes down to implementing it, from a science standpoint, right, you want to stick to what the developers and the evaluators say to do, but then there is also this, well, what do my adults want and need? And if I can't get them, if I can get them there but can't keep them because of the intervention, how do I change that? This is where then I actually turn back to you, Nate, and know that you and the Prevention Research Center have a lot of resources to help think that through. Is when can you make changes to programs that still keeps the efficacy high and in line, and where can you modify? And so if any of you who are listening to this today or recording later on, if you are challenged by that, I would say reach out to the Prevention Research Center. Not only does Nate have, some nice answers and ways to think about that, but so does his staff, and they've been doing a really nice job at trying to create that. So I'm kind of punting it back to you because I don't have an easy answer, and you might even say it's not always easy either.
I am just dropping a shameless plug for the Prevention Center's Implementation Toolbox, where we have a lot of resources on the importance of implementation fidelity for evidence-based programs, but also best practices when those adaptations need to be made to fit communities' unique culture and context. And so, these are, oops, I didn't hit send. There we go. Now they're out there. These are really topic general. They're not specific to any one developmental period or any one outcome. You can think of these best practices for evidence-based programs for aging populations as well. So nice plug. That wasn't even planned, Christine. That was great. Okay. So you talked about grand cares. I hear you have an idea for another intergenerational or grandfamilies program called GROWY.
Yes, GROWY.
Yeah, can you tell us a little bit about that? And
Yeah, so GROWY, so if I can remember what GROWY stands for. So GROWY stands for Grand Family Relationship and Optimal Well-Being Through Education and Yoga. So that's GROWY, right? So I perhaps I need to kind of, so you might all be thinking, first of all, why yoga? Okay, so this is, let me take a back step first. Oh, this was a few years ago now, 2018, my colleague and I, Dr. Arlene Schmid, who's faculty in the occupational therapy department, we received NIH funding to create and implement a yoga and education program for people who experience chronic pain and their caregivers, right? So it kind of in line in prevention science. So with the hope of trying to prevent further pain, further chronic pain and or reduce pain for that matter, pain severity and pain intensity, we brought, received this funding for yoga and education, because we know through our research is that education, we can see changes in outcomes we're interested in, and yoga we can see changes, but couldn't we see even greater significance or even more changes if we brought them together? And so in that case, we also recognize that most of our prevention programs or chronic disease self-management programs for adults and older adults really focuses on the individual with the chronic illness and doesn't always include the caregiver. And so that's why we wanted it both for the care receiver and the caregiver. So we were pretty successful in that grant, saw some trends and changes, and because of the conversations that my colleague Arlene Schmid and I had over the years, and this great success of the Grand Cares project that I said earlier, and a third thing, because of the 6-month follow-up when we conducted focus groups with grandparents who participated in Grand Cares, they often said they started doing yoga as the result of the Grand Cares project, which we were like, this is interesting. It's not something that we promote in the Grand Cares project, but it just happened. And so we're like, okay. So we came up with this new program, GROWY. So all of that, plus then continuing these assessments and also interviews with grandparents to think about how could we not just sit. Oftentimes when we're doing educational programs, we just sit and we're not moving our bodies. And yet we know physical activity is really important. So one form of physical activity that we're trying to test is yoga. And so the GROWY program is intergenerational. So both grandparents and grandchildren together, learning, right? And then engaging in a yoga practice. So we have given it what some might say the old college try this last year, and have written multiple grants and have not gotten a hit yet. But we know somebody out there is willing to fund this work, and we know grandparents will come. I have, as I've shared already, I am connected pretty well with our grandfamilies in the community to which we serve, and they're constantly asking me, when are you going to get this funded? Because we've been talking about it for a while, and then put ideas to paper this last year a couple times. So yeah, so if any of you out there listening are interested in GROWY or have ideas on funding, that would be great to talk more about.
Nice. All right. So that's a recent step, and something that will hopefully be starting soon. The last, I guess, formal question that I have for you is, what do you think then are the important next steps for the field of healthy aging research? And then what do you see as prevention's role in those next steps?
Oh, it's such a good question. Yeah, next steps. Well, so I think for first and foremost, and this is something just to kind of talk about with like the scholars, and so any of you that are on here is really thinking like, let's have a menu of prevention, science, and healthy aging. Like really start to map that out. As I said at the beginning of the hour, I think for my brain, I'm starting to think about it as like this typical age-related changes, and then age-related changes often due to disease and how we can prevent that. And then maybe later in life when we're talking about frailty. So how can we frame really prevention, science, and healthy aging so that scholars and those of you in the field that are working can think, oh, I can find myself and my interest in this box, right? Or this, maybe not to put us in boxes, but in this space, to think that out. And so I think that's one area that we could do. I think another place that we haven't talked about all the other perhaps stressors that happen as we age. I mentioned family caregiving, but there's nuances in that. Like, what if you're an ex-spouse or partner and there's nobody to caregive for that ex-spouse or partner? How might that situation look very different, than if you are currently partnered with somebody, or if you're an adult child providing care, right? Just thinking that through. But, how is retirement a stressor? And what can we do to prevent stresses and strains when somebody is planning for retirement? Because planning for retirement is not just about finances. It's about how do you take the majority of maybe your work roles, if you think about a typical week and the number of hours you spend at work, and those go away and you haven't planned for that, right? And then you find there's some challenges, right? So thinking about prevention science from a retirement standpoint, but also, thinking through, again, what I didn't mention, earlier is, are there prevention programs when you've been partnered or married for 30, 40 years and find yourself going through divorce or perhaps a loss of a spouse, right? Thinking about widowhood. So I think there's a number of areas that we could think about prevention science that we have not even started to talk about, quite honestly. And I think that we should. I don't know what that looks like, if it's prevention from a clinical standpoint, from having, thinking therapeutic interventions, marriage and family therapy, clinical psychology kind of intervening in those spaces. But even backtracking before intervening, like preventing for some of the challenges that widows and widowers go through. We don't talk about that, right? We don't talk about end of life or death and dying, or when a long-term relationship ends for some reason. So I think those are spaces that I have not seen are being discussed in the prevention, healthy aging standpoint that we should address.
Yeah, there are spaces like that for programs that are geared more towards younger, for children and adolescents, emerging adults. We have these registries of evidence-based programs like Blueprints and the What Works Clearinghouse and Castle's model programs. We have tons of those for younger individuals early in the lifespan, but they don't exist for folks in the later end of the lifespan. I think probably a lot of it is due to the fact that this looking at the intersection between healthy aging and prevention science is so young, and the work that you're doing is so innovative that hopefully that will catch up. And maybe that's something that we could put together at the prevention center or something like that. But yeah.
And to be fair too, I will add the Administration for Community Living, which is part of Administration on Aging. They do have lots of information around, evidence-based programs kind of focus on older adults, but there's not a one-stop shop, quite honestly, for me, because we've got CDC, we have NI, National Institute on Aging, we have a multiple different areas that I tend to go to first, but like who can really create something like blueprints. I love the blueprints one, and I know about blueprints because most of my students want to work with children or young adults, and so I usually send them there first. But I wish there was an equivalent that was easy to navigate, like blueprints for healthy aging and adult development and aging.
Great. Well, that was awesome.
Go ahead.
Yeah.
I'm going to pop my email into, I think I just put it in there. This is my email, so if anyone wants to reach out to me, you can send me an email. And also on our HDFS webpage, you can read a little bit more about some of my work as well.
Great. Well, we have 2 questions remaining in the Q&A. The first one is, does your department consider research and prevention of Alzheimer's and dementia in the elderly?
I love that. Yeah, thank you for bringing that up. Yes, I absolutely would say our department considers that. And in particular, we have 2 researchers that I think are outstanding colleagues in that space. The first one is Dr. Aga Brzezinska. So one of the things, she has actually been funded by the Alzheimer's Association. One of the things that I know she is trying to pinpoint from a prevention science standpoint, quite honestly, is that moment when we start to see changes in the brain related to Alzheimer's. And I think that, so she does a lot of neuroimaging, brain scans. And so she's, from my understanding, some of her work has really tended to focus on what is that like precise moment, with a hope that these brain scans, they could do early detection of Alzheimer's or dementia and then Alzheimer's disease. And as we all know, the earlier we can detect, the better then we can help intervene and then slow down the illness, because it is a progressive illness. So there's Aga's work, and then Dr. Allison Belock, she's also very much interested in looking at the link between activities and cognition. And so thinking through, how do we spend our time? What do we do on a daily basis, or even a minute by minute basis in the context of activities that stimulates the brain, that keeps the brain healthy, with the goal of thinking about reducing cognitive aging and then leading to disease. So those are 2 specific researchers. There's other researchers that I think are also operating in that space outside of our department. And at CSU, we have the Colombian Health System Center for Healthy Aging, which is a great resource. I think they've actually identified over 65 or 70 faculty on campus that are engaged in some type of aging-related research. So I also would direct you to checking out that website.
Nice. All right, thank you. And this question actually connects with some of the coalition work that we do here at the Prevention Center. So we have a question. Our Communities That Care Coalition would like to begin intergenerational work with our local senior center as a way to build community relationships and connections to reduce risk factors for the youth. Do you have any suggestions on the best first steps we could take to make this successful?
Oh, goodness. Yes, I feel like, okay, so if you got my email me. I think that some of the work that's happening now in Gilpin and Chaffee County this summer with our extension office is going to focus on intergenerational programs. But actually, now that I think about it, here's a website you should check out. So Generations United. So just gu.org. Generations United is a nonprofit out of DC, And they have two main focus, intergenerational programs and grandparents raising grandchildren. They are a clearinghouse of best practices for intergenerational programs. And what I can also tell you is my dear mentor, who was at Virginia Tech and is now at the Ohio State University College of Social Work, Dr. Shannon Jarrett, is a real leader in intergenerational programs. I'm happy to make a connection for you, should you want to go that route. But I would first start with Generations United. You can also reach out to me. There might be some great work that we're doing in Gilpin and Chaffee County that could piggyback on what you're doing. It's exciting. Kudos to all of you. I think that's so fun.
That is exciting, and unfortunately, that's all the time we have. Christine, this is so fun to be able to sit down and talk with you about your great work. Thank you all for joining us today for this episode of the CSU Prevention Extension Cast, and we will connect again next month when we have our next Prevention Extension Cast on community coalitions with Dr. Brian Bumbarger. So in the meantime, take care, and we'll see you next month.
Bye, everyone.